Week 2 has opened and we will be discussing Chapter 8, Skin Diseases and Disorders. In Week 1, we discussed the structure of the skin and how it protects our body, and also how to keep it healthy. Upon completion of Chapter 8, you, the learner, will be able to identify and describe common skin lesions, differentiating between primary and secondary lesions, list and describe common disorders of the sebaceous glands, list and describe common changes in skin pigmentation, identify the forms of skin cancer, including symptoms and mortality rates, identify and describe the major causes of acne and current treatments, list the factors that contribute to the aging of the skin, explain the effects of exposure to the skin from the sun, describe contact dermatitis and prevention measures for cosmetologists. Skin is the largest organ of the body, and it's vital to our very existence. While it is designed to protect us, it is also the most visible organ of the body, and healthy skin is often associated with good health in general. Choosing a career in skincare to help people achieve maximum skin health and overcome or reduce the effects of skin disorders can be very rewarding. Skincare specialists are in high demand in many salons and spas, and they earn excellent salaries. Some stylists find caring for the skin less physically demanding than styling hair and choose to balance their day by scheduling services in both areas. Skincare is an area of rapid change and growth and a topic on most clients' minds. Knowing the basics of skincare and how the skin functions will allow you to advise clients on their skincare regimens when they seek your professional opinion. The skin is susceptible to a variety of diseases, disorders, and ailments. In your work as a practitioner, you will often see skin and scalp disorders, so you must be prepared to recognize certain common skin conditions and know which you can help to treat and which must be referred to a physician. It is very important that a salon not serve a client who is suffering from an inflamed skin disorder, infectious or not, without a physician's note permitting the client to receive services. Okay, I want you to grab a mirror or stand in front of a mirror, and I want you to do a facial analysis. With this analysis, I want you to look at your skin, your face, your neck, your décolleté, which is your chest, and I want you to jot down the abnormalities that you may find. Examples would include pimples, discolorations, or skin tags. Once we go through this lesson, I want you to then go back and jot down the proper term for each abnormality that you have found. Remember to record your answers in your Blackboard Week 2, Section 1 assignment section. Now we're going to talk about lesions. A lesion is a mark on the skin or structural change in tissues caused by injury or disease. Lesions are categorized into two. We have primary and secondary. Primary lesions are a different color than the color of the skin and/or lesions that are raised above the surface of the skin. They are often differentiated by size and layers of skin affected. They may require medical referral. Secondary lesions are characterized by piles of material on the skin surface, such as a crust or a scab, or by depressions in the skin surface, such as an ulcer. Okay, we are now going to take a look at some primary lesions. The first picture we have a bulla. This is a blister containing a watery fluid similar to a vesicle but larger. It requires a medical referral. The second picture of behind the ear is a cyst. This is a closed, abnormally developed sac containing fluid pus, semi-fluid, or morbid matter above or below the skin. It also requires a medical referral. Your third picture is a macule. This is a flat spot or discoloration of the skin. And your last photo is a nodule. This is a solid bump larger than 0.4 inches or 1 centimeter that can easily be felt. It also requires a medical referral. You may not work on any of these lesions without a physician's permission. We're continuing to look at primary lesions. Our first photo here is a papule. This is a small elevation on the skin that contains no fluid, but may develop pus, also known as a pimple. Our second picture is a pustule. This is a raised, inflamed papule with a white or yellow center containing pus in the top of the lesion. Your third picture is a tumor. This is an abnormal mass. It may vary in size, shape, and color. Any type of abnormal mass, not always cancer, requires medical referral. Our fourth photo is a vesicle. This is a small blister or sac containing clear fluid lying within or just beneath the epidermis. This requires medical referral if the cause is unknown or untreatable with an over-the-counter product. Our last picture is a wheal. This is an itchy, swollen lesion that can be caused by a blow, scratch, or insect bite, or skin allergy. Now we will identify secondary lesions. Our first photo is of a crust. This is dead cells that form over a wound or blemish while healing. It's also accumulation of sebum and pus, and sometimes mixed with epidermal cells. Next, we have a fissure. This is a crack in the skin that penetrates into the dermis. Our third illustration is an excoriation. This is a skin sore or abrasion that's produced by scratching, scraping, or picking. Our last photo on the top row is an illustration of a keloid. This is a thick scar resulting from excessive growth of fibrous tissue. Keloids will form along any type of scar for people susceptible to them. On our bottom row of photos, the first photo is a scar or cicatrix. This is a slightly raised mark on the skin formed after an injury or lesion of the skin has healed. Our middle photo on the bottom row is an illustration of a scale. This is thin, dry, or oily plate of epidermal flakes. Example is excessive dandruff. Our last photo on the bottom row is an ulcer. This is an open lesion on the skin or mucous membrane of the body, occupied by loss of skin depth and possibly weeping of fluids or pus. This requires a medical referral, particularly in clients with underlying medical conditions such as diabetes. Remember, if the skin is irritated, inflamed, or broken, you as a cosmetologist will not provide a service for that client. Now we will discuss disorders of the sebaceous glands. First, we have comedones. These are open or closed. So an open comedoe, also known as a blackhead, is a hair follicle filled with keratin and sebum. Comedones appear most frequently on the face, especially in the T-zone, your forehead, nose, and chin. When the sebum of the comedoe is exposed to the environment, it oxidizes and turns black. Your closed comedoe is when the hair follicle is closed and not exposed to the environment. The sebum remains a white or cream color and appears as a small bump just under the skin surface. This is also known as a whitehead. Next is milia. This is benign keratin-filled cysts that appear just under the epidermis and have no visible opening. They resemble small round sesame seeds. Next, we have acne. This is a skin disorder characterized by chronic inflammation of the sebaceous glands from retained secretion and bacteria known as Propionibacterium acnes or P. acnes, the specific term for acne bacteria. Continuing disorders of the sebaceous glands, we now have sebaceous cysts. This is a large, protruding, pocket-like lesion filled with sebum. Sebaceous cysts are frequently seen on the scalp and the back and may be surgically removed by a dermatologist. Seborrheic dermatitis is a skin condition caused by an inflammation of the sebaceous glands. It's often characterized by inflammation, dry or oily scaling, or crusting and or itchiness. Red, flaky skin often appears in the eyebrows, in the scalp and hairline, middle of the forehead, or along the sides of the nose. A dermatologist will prescribe topical antifungal medications. In the salon, a non-fatty skincare product designed for sensitive skin can be used. Lastly, we have rosacea. This is a chronic condition that appears on the cheeks and nose, characterized by redness, telangiectasia, which is the dilation of the blood vessels, and formation of papules and pustules. Factors that aggravate rosacea are spicy foods, caffeine, alcohol, exposure to extreme heat and extreme cold, or sunlight, and stress. Let's discuss disorders of the sudoriferous gland. First, we have anhidrosis. This is a deficiency in perspiration or the inability to sweat. It's often a result of damage to the autonomic nerves. This condition can be life-threatening and requires medical attention. Next, we have bromidrosis. This is a foul-smelling perspiration. It's usually noticeable in the armpits or on the feet. That is generally caused by bacteria. Severe cases require medical referral. Hyperhidrosis is excessive sweating caused by heat or general body weakness. This requires medical referral. Lastly is miliaria rubra or prickly heat. This is an acute inflammatory disorder characterized by an eruption of small red vesicles and accompanied by burning and itching caused by exposure to excessive heat. Okay, we're going to recognize inflammations and common infections of the skin. Conjunctivitis is also known as pink eye. It's a common bacterial infection of the eyes. It is extremely contagious and should be referred to a physician. You want to make sure you discard products or implements that have touched an infected eye. Next, we have dermatitis. This is a term broadly used to describe any inflammatory condition of the skin. Eczema is an inflammatory, uncomfortable, and often chronic disease of the skin. It is characterized by moderate to severe inflammation, scaling, and sometimes severe itching. Herpes simplex. Herpes simplex 1 is a recurring viral infection that often presents as a fever blister or cold sore, although many people have no symptoms. It is characterized by the eruption of a single vesicle or group of vesicles on a red swollen base. The blisters usually appear on the lips, nostrils, or other part of the face, and the sores can last up to 3 weeks. Herpes simplex 2 is caused by the same virus and is designated as type 2 because it occurs below the waist. Herpes simplex is contagious and requires medical referral. Drugs are now available to control the symptoms, but the virus always remains in the body of infected persons. Impetigo is a contagious bacterial skin infection characterized by weeping lesions and usually caused by Staphylococcus bacteria. Impetigo normally occurs on the face, especially around the nasal passages, and is most frequently seen in children, although it is possible at any age. Lastly, we have psoriasis. This is a skin disease characterized by red patches covered with silver-white scales and is usually found on the scalp, elbows, knees, chest, and lower back. It is rarely found on the face. Psoriasis is caused by skin cells turning over faster than normal, and when the condition is irritated, bleeding points can occur. Psoriasis is not contagious, but it does require medical referral. It is treatable, but it is not curable. Recognizing pigment disorders of the skin. Pigment can be affected by internal factors such as hereditary or hormonal fluctuations, or by external factors such as prolonged exposure to the sun. Abnormal colorations known as dyschromia accompany skin disorders and are symptoms of many systemic disorders. Hyperpigmentation is darker than normal pigmentation in splotches. Hypopigmentation is the absence of pigment and resulting in light or white splotches. Albinism is a congenital hypopigmentation or absence of melanin pigment of the body, skin, hair, and eyes. Hair is silky white. The skin is pinkish white and will not tan. The eyes are pink and the skin is sensitive to light and ages prematurely. Chloasma is a condition characterized by hyperpigmentation on the skin in spots that are not elevated. They are generally caused by cumulative sun exposure and can be helped by exfoliation or can be treated by a dermatologist. This is also known as the mask of pregnancy. Lentigines is the technical term for freckles, small yellow colored to brown colored spots on skin exposed to sunlight and air. It is also commonly referred to as liver spots in older people, although there is no relation to the liver. Leukoderma is a skin disorder characterized by light, abnormal patches, which is hypopigmentation. It is caused by a burn, scar, inflammation, or congenital disease that destroys the pigment-producing cells. Nevus is a birthmark, small or large malformation of the skin due to abnormal pigmentation or dilated capillaries. Stains are abnormal brown or red skin patches having a circular or irregular shape, occurring during aging, after certain diseases, and after the disappearance of moles, freckles, and liver spots. Tan is the change in pigmentation of skin caused by the exposure to the sun or ultraviolet light. Vitiligo is a hereditary condition that causes hyperpigmented spots and splotches on the skin that often appear milky white. Skin with vitiligo must be protected from overexposure to the sun. Hypertrophies of the skin. A hypertrophy is an abnormal growth of the skin. Many are benign or harmless. First, we have a keratoma, also known as a callus, an acquired, superficial, round, thickened patch of epidermis due to pressure or friction on hands and feet. If it grows inward, it is called a corn. A mole is a small brownish spot or blemish on the skin, ranging in color from pale tan to brown or bluish black. Some moles are small and flat, resembling freckles. Others are raised and darker in color. Large dark hairs often occur in moles. Any change in a mole requires medical attention. Skin tag. Small brown or flesh-colored outgrowth of the skin. It occurs most frequently in the neck and chest. Verruca, also known as a wart, is a hypertrophy of the papilla and epidermis. It is caused by a virus and is infectious. Verruca can spread from one location to another, particularly along a scratch in the skin. A dermatologist can be helpful in removing and reducing the reoccurrence of warts. Now I'm going to have you analyze the visible portions of your legs, arms, hands, and neck. I want you to identify any hypertrophies of your skin. Once you have listed each hypertrophy of your skin, I want you to record the size and location of each. You are going to record your findings in your week 2, section 1 portion of your Blackboard assignment. I want you to keep this as a reference tool as well, and in 2 or 3 months from now, I want you to go back and revisit these spots and jot down any changes to these spots. Take a few minutes and give yourself an examination. Now we are going to understand skin cancer, and we will be able to identify each skin cancer. First, we have a basal cell carcinoma. This is the most common and least severe skin cancer. It is categorized by light or pearly nodules and has a 90% survival rate with early diagnosis and treatment. Next, we have a squamous cell carcinoma. This is more serious than the basal cell carcinoma. It is characterized by scaly red papules or nodules. It can spread to other parts of the body, and survival rates depend on the stage at diagnosis. Lastly, we have a malignant melanoma. This is the least common, but is 100% fatal if left untreated. Early detection and treatment can result in a 94% 5-year survival rate, but that drops drastically to 62% once it reaches local lymph nodes. Clients should be advised to regularly see a dermatologist for checkups for the skin and do home self-exams. If it's detected early, anyone with these 3 forms of skin cancer has a good chance for survival. You would not perform any services over any areas with basal cell, squamous cell carcinoma, or malignant melanoma. Always refer your clients to their physician. If you come across a client that has a spot that you are not aware of what it might be, always go to your instructor so we can go and take a glance at it, and we can let you know if the service is a go or no. The American Cancer Society at www.cancer.org has put together a cancer checklist, and it is called the ABCDE Cancer Checklist. A stands for asymmetry. Is the spot asymmetrical? If we were to draw a line in the middle, would both sides of that line be symmetrical or asymmetrical? Your B stands for border. Is the border a solid border or is it a wavy border? Does the spot run out of a border? Color. Is the color irritated? Is it a different color from the flesh? Diameter. Has the spot grown rapidly? Evolving. Is it changing texture or shape or color? This checklist is good for you as a cosmetologist and for your clients. Again, if you have any questions when you're working with a client, if a spot arises or on yourselves, please talk to an instructor. We can direct your client to seek a physician's guidance. Again, this is coming from the American Cancer Society at www.cancer.org. You can visit this website for more information. We're going to jump into acne and problem skin. Acne is both a skin disorder and an aesthetic problem. It is a major concern to anyone who suffers from it. Frequently misunderstood to be a teenage skin disorder, it can affect people at almost any age. A predisposition to acne is based on heredity and hormones. Retention hyperkeratosis. This is the hereditary tendency for acne-prone skin to retain dead cells in the follicle, forming an obstruction that clogs follicles and exacerbates inflammatory acne lesions, such as papules and pustules. Propionibacterium acnes. These bacteria cannot survive in the presence of oxygen. When the follicles are obstructed, oxygen is blocked from the bottom of the follicles, allowing acne bacteria to multiply. When the bacteria multiplies, it causes inflammation and swelling in the follicle, and eventually rupture the follicle wall. An acne papule is an inflammatory acne lesion resulting from this wall rupture and effusion of blood. A pustule forms from the papule when enough white blood cells accumulate to form pus, which is primarily composed of dead white blood cells. When customizing a treatment for acne-prone skin, you want to choose a cleanser that removes dirt and oil. A foam cleanser will be great for minor acne. It is light and airy. A gel cleanser dries the oil and cleans deep to pull out impurities. Gel can be harsh on sensitive skin. Gel cleansers will be great for stubborn acne. Toner. You want to choose a toner that's right for acne. Toners with ingredients such as witch hazel, aloe vera, rose, and green tea are all ideal for acne. An exfoliant. You do not want an exfoliant that is grainy, as it can spread bacteria to other areas of the face. exfoliants with ingredients such as alpha hydroxy acid, salicylic acid, and benzoyl peroxide are all great for acne. Next, a mask. Acne skin will benefit from a clarifying mask as it will pull impurities to the surface. You want to use clarifying mask for more severe cases of acne. A cooling mask will calm any irritation and redness associated with acne. Menthol and tea tree, which are found in some cooling masks, combat bacteria. Choosing the perfect moisturizer. For acne-prone skin, a lightweight and oil-free moisturizer are great. They are non-comedogenic, which means they will not clog the pores. Analyzing aging skin issues. Aging of the skin is a concern of almost every client over 30 years of age and has become a major area for new services and retail revenue within the salon and spa environment. There are two types of factors that influence aging of the skin: intrinsic and extrinsic factors. Intrinsic factors are skin aging factors over which we have little control. These are genetics and ethnicity play a significant role in how our skin will age. Our predisposition to skin disorders and genetic predisposition for the ability to tolerate sun exposure also play a role. Gravity, the constant pulling down on our skin and bodies, and is a consistent factor for everyone. Facial expressions, the repeated movements of the face and result in the formation of expression lines such as crow's feet lines that form around the eyes, nasolabial folds that form from the corners of the nose to the corners of the mouth, and scowl lines that form between the eyes. Extrinsic factors are primarily environmental factors that contribute to aging and the appearance of aging. Many scientists and dermatologists believe that these extrinsic factors are responsible for up to 85% of skin aging. Tanning and sunbathing are significant offenders in the prevention of both aging and cancers of the skin and should always be discouraged by skincare professionals. Smoking produces tremendous numbers of free radicals, unstable molecules that cause biochemical aging. These molecules over time can have a devastating effect on the body, causing wrinkling and sagging of the skin, particularly on the face and neck. Alcohol use inhibits the body from repairing itself and interferes with proper nutrition distribution to the skin and body tissues. The constant dilation and contraction that occur on the tiny capillaries and blood vessels, as well as the constant deprivation of oxygen and water to the tissues, quickly make the skin appear lifeless and dull when mixing smoking and drinking together. Stress plays a significant role in our overall health and contributes to premature aging of all organs, including the skin. Poor nutrition deprives the skin of the proteins, fats, carbohydrates, vitamins, and minerals that are required to maintain, protect, and repair the skin. Keep it looking young and beautiful. Pollution also produces free radicals and interferes with proper oxygen consumption. Understand the sun and its effects. The sun's ultraviolet rays have the greatest impact on how our skin ages. Approximately 80 to 85% of the symptoms of aging skin are caused by the accumulation of damaging rays from the sun. As we age, the collagen and elastin fibers of the skin naturally weaken, and this weakening happens at a much faster rate when the skin is frequently exposed to UV light without proper protection. UVA rays, also called aging rays, deep penetrating rays, weaken the collagen and elastin fibers, causing wrinkling and sagging of tissue. UVB rays, also called burning rays, causes sunburn and tanning of the skin by affecting the melanin sites. These are cells of the epidermis that produce melanin. These rays are not as deep as UVA, but are equally damaging to the skin and eyes. They do, however, contribute to the body's synthesis of vitamin D. How do you protect your skin? And this is the last exercise of this PowerPoint, and I want you to jot down on a piece of paper for you to keep, and also in your Blackboard Week 2 Section 1 assignment. I want you to think about the ways that you protect your skin from the sun. I want you to jot them down, both on a daily basis and when you know you'll be in the sun for a prolonged period of time. Protecting yourself from the sun includes you want to avoid deliberate exposure, and to use a broad spectrum sunscreen, which is one that filters both UVA and UVB rays and has an SPF or sun protection factor of at least 15 on a daily basis. Avoid prolonged exposure, especially during peak hours of 10 a.m. to 3 p.m. Apply sunscreen liberally. Apply 30 minutes prior to exposure. Apply sunscreen liberally after swimming and after activities that result in heavy perspiration. Avoid exposing children under 6 months old. Wear a hat and protective clothing. People who are prone to burning frequently and easily should wear a hat and protective clothing when participating in outdoor activities, in addition to using sunscreen. Redheads and blue-eyed blondes are particularly susceptible to sun damage. Recognizing contact dermatitis. Contact dermatitis is the inflammation of the skin produced by certain chemicals and substances that have come in contact with the skin. First, we have allergic contact. Allergic contact dermatitis, which is abbreviated as ACD, occurs when a person, cosmetologist or a client, develops an allergy to an ingredient or a chemical, usually caused by repeated skin contact with the chemical. Sensitization is an allergic reaction created by repeating exposure to a chemical or a substance. Common places for allergic contact dermatitis include on the fingers, palms, and on the back of the hand, on the face, especially the cheeks, and on the scalp, hairline, forehead, and neckline. Next, we have irritant contact dermatitis. This occurs when irritating substances temporarily damage the epidermis. Corrosive substances or exfoliating agents are examples of products with irritant potential. Contact with irritant chemicals can cause damage to the epidermis because the irritant can enter the skin surface and cause possible inflammation, redness, swelling, itching, and burning, and repeated exposure can worsen the condition. The best way to prevent both types of occupational contact dermatitis is to use gloves or utensils when working with irritant chemicals. Cosmetologists should use gloves or utensils when applying chemicals such as hair color, straighteners, or permanent wave solutions. Nail technicians should use gloves or utensils when applying nail products such as monomer liquids and polymer powders. Estheticians should use gloves or utensils when applying exfoliants such as peeling products and drying agents. All of these chemicals can irritate the skin of the hands and arms if precautions are not taken to avoid contact. As a cosmetologist, you want to protect yourself. You want to take time to keep implements, tools, equipment, and surfaces clean and disinfected. Keep brush handles, containers, and tabletops clean, free from products, dust, and residues. Wear protective gloves when using products known to cause irritant or allergic contact dermatitis. Keep hands clean and moisturized. Keeping the skin of the hands in excellent condition will help prevent irritant reactions. This concludes Chapter 8, PowerPoint. Please proceed with the rest of your assignments, and I'll talk to you next week.